a new series called Home Care 101. And for some of you, this will be the basics, right? So we're starting from the beginning. It's because I always say there's a lot of information out here about starting a home care agency, but some of it can be very, very, very confusing, right? If you've ever been confused just researching, looking up, watching someone's video about what is home care, what is home health care, let me know in the comments if you feel like, okay, once you feel like you're going down a rabbit hole, it's like so much information. If you feel like that has been you when you started looking up information, let me know in the comments, right? So I want to kind of start from the basics. And I'm a big firm believer that some people learn better, with just like a conversation. We're talking, we're having a conversation, and I'm just breaking things down to you. Again, don't forget to let me know where you're watching me from. So today we're going to start with the basics. I also believe that some of you don't know how vast this industry is. So when you see coaches, consultants, people that are being successful in this industry, and they share an idea that they have, like, you know end of life care, or they share an idea that they have like cancer care. That's one of the things that we're working on this month with my home care mentees. You're like, where did that come from? Where did that service come from? And where does it fall into the home care services spectrum? And so that's why I said we need to start from the basics, get you guys a basic understanding. And so for some of you, if you haven't already, jumped on a free call with me, I do free calls on every Thursday. This is going to now answer a lot of questions for you. Okay. So before we get started, um, if you are not licensed, you are new to home care. Again, you're not licensed, you're new to home care. Give me a number one. Not licensed, new to home care. Give me the number one. I did a similar um, series like this before, and it was a part of the Hillman talk. Okay, all right, thank you. All right, I got someone trying to message me right now. Hey, I need help with getting licensed, right? And so let's start here. If you guys don't mind, let's start here. We're going to make this a little bite-sized session. And because of the way that I teach things, I want to start with a little history of home care, right? Where's my thing? I tried to do this with, one of those uh what you call baby CEO avatars, but I like the way it looks. But let me tell you the little history of home care. So thank you for those who put the number one. You're new, you're not like yet licensed. Also, don't forget to let me know where you're watching from. Okay, so because this is a new series, I want to do this a little bit different. I've got a little bit of history of home care, right? So let's go back. I'm going to take you back to the 1800s, right? Home care, and I am reading part of this, right? Because the part that I know without reading is when it starts at Visiting Angels, right? If you're familiar with the franchise home care agency Visiting Angels, let me know in the comments. Say me, or you can say not me, right? But home care began as a community effort, right? Meaning there were things that was not in place, right? Community effort, and that's why it's so innate. So that's what I like about, you know, starting here, because it's just a natural thing for if you have a family member, a loved one that's sick, that family members, neighbors, and church volunteers, that's how home care started. Somebody was sick in the home back in the 1800s, early 1900s. It began as a community effort where a family member, a neighbor, or a church volunteer began caring for those loved ones in the home. Now, I love that history because, back then, they have what people are trying to do now. Back then, the doctor came to your home. The doctor did doctor's house calls, right? Now, when a doctor does house calls, they call that concierge services, right? But this is how things started, right? So, what I like about history is that some of those things, it's almost like fashion. Some of those things that were done before, we can bring them back in a new way, right? So they were doing concierge services before concierge services was a thing, right? So it began as a community service, a community effort. And then by the late 1800s, organizations like Visiting Nurse Association, not Visiting Nurse, the agency, began. It was formed, and that's when they trained nurses to go to people's homes to care for the sick and elderly. Hey, good morning. So started with family members, started with church volunteers. And back then the church did a lot, Methodist churches, Baptist churches, they did a lot for the community, right? And which I'm telling you guys that key point because November is something I'm going to be sharing with my mentees and my home care uh, end of the year marketing program is a really good time to market to churches and religious organizations. That's just a little plug for you. Thank you so much for the hearts. And please do. I love the hearts um, as a creator on TikTok, on YouTube, on Facebook. Definitely, it helps let people know about me, what we're sharing when you guys just tap that screen. Just tap that screen. That's all you. That's my feed today, right? Okay, so late 1800s, Visiting Nurse Association formed, sending trained nurses to people's homes to care for the sick and the elderly. All right, so now, because of how I think, okay, those are two distinctive categories, sick and the elderly. All right, a lot of people don't really understand how to identify their market. And back then, they were even in the 1800s, they were already identifying we need to help the sick and the elderly, right? Now, later on in the series, we'll go into what does that look like? What does that look like? Who are sick? What kind of sickness or diseases or illnesses do they have? And of course, the elderly. That's pretty clear. That's 65 and up. This was the foundation of what we call home health care, right? So technically, home health care started a little bit before home care. All right. Home health care started before home care, right? And so that is skilled, medically directed care delivered in the home. That's a good definition. Skilled, medically directed, delivered care in the home. So, and the reason why home health care started before home care We're going to find out when we get to the 1990s, right? We're going to find out when we get to the 1990s, right? Okay, so now let's jump to the 1960s, 1980s. In 1965, Medicare and Medicaid were created. 1965, Medicare and Medicaid were created. Now, I'm not that good with air math, but so technically, Medicare and Medicaid are 60 years old. They have been a major bullet on the federal government's, the state government's agenda for the past 60 years. So I want to plug that in is because prior to this federal government shutdown, when people have said, "Oh, Sean, what do you think about the future of home care with the OBB, One Beautiful Bill, right? What do you think about the future of home care with them saying there are going to be Medicaid cuts and Medicare cuts?" Been on the agenda for 60 years. Major bullet for 60 years. In fact, even right now, as you're listening to this, and we're in the midst of a federal government shutdown, and I'm located physically in the DMV, that stands for DC, Maryland, and Northern Virginia, right? Even though I have mentees as far as California, Washington State, Oregon, right? That's how far I go in the West. And then I'm here on the East Coast. Go as far up as Massachusetts, as far down as Florida. And we're several states in between, covering nearly 30 states with the mentees I have in these United States, right? Even in the midst of a federal government shutdown, guess who is still getting their payments? Anybody want to guess? Anyone want to guess who's still getting payments? Even with essential workers, people who are considered essential workers, some of them didn't get their check today. Some of them didn't get their check today. But guess who is still getting paid? Anybody want to guess? Home care agencies, home health care agencies are still getting paid. Home care agencies, home health care agencies are still getting paid. Home care workers are still getting paid. Home care nurses are still getting paid. I keep saying we are not recession proof. I used to say recession proof. We're definitely recession resistant. It's almost like we're resisting. We resist. We any kind of shutdown, any kind of COVID-19, we'd be like, oh, that's not us. Unfortunately, I can't say the same with some of our brothers and sisters in healthcare. Who are our brothers and sisters in healthcare? Group homes. Love, 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 love me some group homes, right? But some of their programs have been affected. Some of their programs have been affected. Some of their clients aren't getting paid. Not all of them, but if you go into like the sober living, you go into some of these other non-medical programs or group homes, some of them aren't getting paid. They will eventually get paid, but some of them aren't getting paid. But home care, Medicare, and Medicaid that's been around for 60 years, we're still getting paid. Okay, so Medicare and Medicaid was created in 1965. The government began reimbursing for medical home care services such as nursing, therapy, and wound care. Yes, you can get on my calendar. Okay, so listen to what back in 1965, what Medicare said they were going to reimburse for. These are key factors. Key factors: nursing, therapy, and wound care. All right. Okay. This is when home health agencies became an official part of the healthcare system. Prior to that, it was hospitals. So even with the Visiting Nurse Association being established in the 1800s, home health care became an official part of the healthcare industry when Medicare and Medicaid was created. Okay. So we know that Medicare is federal, right? That's why some people, when they say, oh, I want to provide services to seniors and I want to be Medicare certified, I said, not all, just because they're a senior doesn't mean that you will be able to be reimbursed by Medicare. You have to be a Medicare certified agency, and Medicare is skilled. So listening to the history, guys, sorry, my nose is itching. I don't want to say fall allergies. Listening and understanding the history of home health care started first. The skill part started first. And it's not into the 1990s that the non-skilled is kind of like starts to surface. Okay. So sorry if I'm talking slow. I want to make sure you guys understand this clearly. Okay. Okay. So this is when home health agencies became an official part of the healthcare system. And still to this day, Medicare only covers skilled services, not personal care or daily living services. So families still needed someone to assist with bathing, cooking, and companionship. So we have the families and the neighbors and the church volunteers still in place because Medicare to this day, that's why they say Medicare Part A and Part B, they don't cover non not personal care services. So that means if you are a non-medical home care agency, you cannot, it is it, I don't want to put it in the never category, but you cannot be a Medicare, get reimbursed by Medicare because how they established it back in the 1965 is still how it's operating right now. Okay. Okay. So let's jump to the 1990s, right? All right. In the 1990s, okay, entrepreneurs saw that there was a growing need for non medical home care services focused on companionship and daily living assistance. This era gave rise to our household names. These are franchises. Visiting Angels was founded in 1998. Homestead, that's another franchise, was founded in 1994. Comfort Keepers was founded in 1998, and Right at Home was founded in 1995. These are the four main franchises we still have around today. And so, a little backstory is that this is also around the time that the Katie Beckett story kind of got addressed. Anybody familiar with the Katie Beckett story? While I'm waiting for your answer, the Katie Beckett story, uh, it, I'll give it to you a little bit better later. This is the history of pediatric home care, right? And so essentially, there was a young girl, I believe she's 8 years old. This is a story my mentor told me, right? And um, it really helped me to understand because I started off, for those of you who don't know, as a pediatric home health agency, right? So what she said is that there was this little girl. She was in a hospital for 3 years, right? She was in the hospital for 3 years. And so essentially, um, everything was getting exhausted because insurance was paying for this 24-hour round the clock care. And her mom essentially pleaded with the government, um, sent a letter all the way to President Ronald Reagan at the time, and just said, I want to be able to care for my daughter at home. Want to be able to care for my daughter at home. And one of the key things that she did was prove that it was more cost effective for her daughter to be cared for at home. And for those of you who always feel like, well, why would someone want to pay for um, home care services out of pocket? We are actually more cost effective because some people, everybody doesn't need a hospital bed, right? And when someone is at a hospital or facility setting, you're paying for equipment, you're paying for round the clock care, you're paying, you have all of these extra expenses when home care is actually more cost effective, right? So that's where anywhere, and we'll talk about this later on, anywhere in these United States where there is a Katie Beckett waiver, it's a Medicaid waiver, it is because of this mom proving that even through Medicaid, if the state was to pay for, or if the government was to pay for services for children with these kind of diagnoses, it will be more cost effective than keeping them in the hospital setting. Okay. So we have these four franchises that I mentioned that started in the 1990s, right? A lot of people were still in the hospital, even though we had the rise of home health agencies. What still wasn't realized then is that people really needed everyday care, right? These are the things that the family members, the neighbors, the church volunteers were doing. People needed everyday care. That's the personal care. That's the ADLs. And not everybody needed home health services. This is the home health services, sorry, is what the government initially approved or signed off for, right? Everybody didn't need that. So when these franchises started, it was also a good time because the hospitals essentially couldn't keep up with the amount of people that needed to be cared for, because hospitals only have a certain amount of beds, and that outside of the skilled need, when they go home, if that non-skilled need was not met, that could essentially bring them back into the hospital setting. So, these visionaries that started the non-skilled personal care, companionship, um, uh, home care, like visiting angels. These are why these models started off with private pay, right? These are for people who said, you know what, I need additional care outside of the hospital and I don't mind paying it. To this day, these these franchises, they're more private pay um, providers than they are Medicaid. Why? Is because that's how their model started out, right? So their model started off with private pay. So whenever you see them in your state, in your area, their focus is more so on someone who is paying out of pocket versus a Medicaid provider, a Medicaid recipient. My nose is itching really, really weird. Okay, so these companies franchise the home care model, right? Making it possible for individuals across the United States to start local home care agencies underneath their brand name, right? And then this shifted the focus of what's now called private duty home care, where people paid out of pocket or through long term care insurances or Medicaid waiver programs. Okay, so this is in my ebook, The 15 Ways to Get Paid in Your Home Care, Home Health Care Business. But we just mentioned three, right? These are three main ways that you should be getting paid, right? Everybody should be able to get paid these three ways. If you're listening and you heard me say the three ways, put the number 3 in the comments. 3 ways, right? I think when you want to get the ebook, if you have a webinar on before you start a home care agency, watch this. You can get it for $10 versus $49. Okay. All right. All right. Pay out of pocket, long-term care insurance, Medicaid waiver. Right. Okay. So 1965, Medicaid, Medicare started reimbursing. The government started reimbursing. 1990s, a home care on the non-medical side became an official industry. All right. So I'm going to take the youngest one, which was Homestead. They've been around for 30 years, right? All right. So, in my opinion, that is a good um, lifespan of an industry that's been around for 30 years, doing the same thing, providing private duty, home care, non-skilled home care, and those are their three main payers, right? Again, this is home care 101 because I want you guys to stop doubting that this industry is going to fade out. Ugh, gotta take an allergy pill. Sorry, I don't mean to be seeming like I'm digging my nose, but it's like I got a weird little tickle. It's like a tickling itch. Okay. All right. So if you've been wondering or researching, is this a is still a good industry to get into, or should I look somewhere else? Let me know in the comments. Let me know in the comments. If you've been concerned about what are the effects of the one big beautiful bill, is this industry one that is going to last? Let me know in the comments. And my short answer, I still want to know your response, but I'm going to be moving on because I have a 10 o'clock Zoom. These franchises that I just mentioned, you can go do your own research. They are expanding. They are literally expanding. Like if you go look up healthcare news, they'll say, XYZ just opened up a new location in Ohio, in Connecticut, in Indiana. And you have to wonder, why are they expanding when people over here are telling me be very, very concerned, be very, very worried because of the one big beautiful bill. But then you see other movement. What do they know that I don't know? So, do you follow the crowd of fearful people, or do you look at what the innovators are doing? You know, wealth is created in during times of hardship or recession. look at Airbnb, they started during the 2008 housing market, housing crash. So, what could this be telling you about your fears and your doubts and why you haven't taken action yet to start a home care, home health care business when in some of the states that some of you are located, you have a very, very, very low startup. Pennsylvania, $100 for the application. Indiana, I think it's 250. Connecticut, I think it's 300. Florida, we mentioned Ohio, it's like 250, right? Florida, we went over the Florida's homemaker companion agency license under $100. There's some states with a with a higher application fee, but then there's a lot of states that, if you are in those states, then you gotta say, what am I doing over here? Am I just, wait, am I sabotaging my success, my building my legacy because I'm I'm listening to what people are saying. I don't have a full understanding of what they're saying, but I believe them. I trust my doubts more than I trust facts, information. I don't remember the price for South Carolina off the top of my head. Florida has several different license types. So the one I'm saying that is uh the cheapest is the homemaker companion agency. Okay. And I got on here and I think that live is still on my YouTube where I have mentees and people who are not my mentees, people that just contacted me asking for marketing advice, right? Saying, hey, I'm charging $45 an hour with my homemaker companion agency in Florida. Okay. Okay. So right now, the home care industry is regulated. Please, please, please check and make sure that you are, if you're in a regulated state, then you have to follow the rules. I shared how twice yesterday I got two people got on my call and they wanted to kind of like I believe in loopholes, guys. Um, but I don't believe in shortcuts because this is a regulated industry and you don't want to play with what that looks like if you took a shortcut and you're trying to do things under the radar. It does catch up to you, specifically in this industry. I shared how I wouldn't be the one to report you. If I had someone told me yesterday she's been in business for 10 years, 10 years in Georgia, providing private pay services. She's making high six figures. And she told me something that it bothered me, that she was providing skilled services as a CNA. I said, okay. I said, please don't market your home care business. She asked me for market advice. I said, please don't market your home care business because right now you're underneath some grace that God has given you, and we pray that stays up like an umbrella. But man, if you start marketing and people find out about you, then don't best believe when if the state will have no mercy on whatever fines or whatever they will come down on you with. So I essentially told her I did not want to help her market her home care business because not because I don't want her to be successful, but because she's not licensed, number one. And number two, uh, it it will cause her to possibly get found out by the state. Now, I have several examples of how people who are not licensed providing services, and guess what, you guys are like, how are they doing this? They're doing this and they're getting private pay, that private pay that you guys say is so hard to get. They're doing it and they're getting private pay, and that's why they think that it's okay, because their business is registered. They have like a LLC or INC. They got an EIN number, and they feel like because their business is registered, that they're not doing it with their name. So they feel like they did something right. And I would say that's a good first step, but you never know who's going to report you. So that's what, okay. So going back to, I won't report you, but guess what? I've gotten DMs before prior to my Savvy Business Chick Instagram getting hacked at 25K followers. I had a young lady who's a CNA. She was like, I want you to help me start a home care business. Right now, I'm trying to build my money up, and she was like, I can't afford to join the Kickstarter program. Totally fine. I said, continue to, watch every live, get as much information as possible. Be looking out, on Black Friday. We always do like big, big things for our DIY kids. And so then in the course of time, she reached out to me and she says, well, I never told you that I'm working for an agency, but really they're not an agency. And she's not licensed and she's providing services to people and she's not licensed. And I'm working on one of her cases. She didn't pay us. Well, actually, she didn't pay me, and she's not answering my question about when I'm going to get paid. How can I report her? Guys, I didn't want to give her a direct answer. I try not to sow those seeds of somebody getting reported, So I already answered that question, Braids by Candy. Um, um, I already answered that question. If you guys want to continue to think that the financial climate is going to affect this industry, I'm going to tell you, don't get started, because you're going to be your doubts are going to overpower your ability to succeed. Don't get started. If you got to ask me, and I'm not saying it's not a bad question, so I don't want you to feel like you're asking a bad question. If you got to ask that question over and over and over, what is the government shutdown going to affect home care? Is the one big beautiful bill is going to affect home care? You're in a sense, you're thinking like an employee and not a uh, business owner or entrepreneur. I was in a Facebook group where this lady helps people get federal government contracts, and she shared how someone was recently awarded a federal government contract. He got it. It's like a worth 924,000. That won't make much sense to you to still go after business, because you're thinking paycheck to paycheck. Well, when do I get paid? When the government settles their rift with each other. You still win the contract. You still win the contract. But that's just an example of how your employee mindset says, what if I don't get paid? why would they still post about business as usual? Okay. All right. Okay. So today, home care has evolved to a regulated technology support industry focusing on aging in place. I want you to put that in the comments. Aging in place. And I'm sharing all of this, and you guys gave me 245 likes today or hearts today. No problem. No problem. You're gatekeepers. Okay. Aging in place. Aging in place. You can do your own research yourself after this live. Aging in place. Those are all of the programs being developed over for the next 5 years. Why? Because I've shared before that all roads lead to these baby boomers where we will be at what should I call it? There will be the highest peak at 2030. The highest peak is at 2030, where we will have 70 million seniors or 70 million people at 65 and up, right? There's somebody now that's 70, they will be 75. Me personally, I think our best group is between 75 to 85 because we got a lot of seniors that are a little bit more healthy, but we also got some seniors that are not as healthy, right? So whether they're turning 65 or they're going to be at that sweet age of 75 to 85, I feel like that's a really, really, really good. It's a 10-year span. If we were to cut that number in half to 35 million, who would just be cool with 100 clients from that 35 million? Say me. Because we already showed that your your equation for your first million in revenue is between 15 to 21 clients, right? So let's say if it was 20, right? You could be at 5 million in revenue. You could be at 5 million in revenue. But instead of you seeing the opportunity, you say, but what about the one big beautiful bill? They know it's coming. The federal government knows it is coming. Why do you think? Because the news says people, there are some, I would not lie to you, there are some people who will lose their, some of their hours, some of their benefits. That's going to happen. It is probably one of the greatest purges that has happened since it started. Unfortunately, things like this need to happen because Medicaid has had so much waste. Now, I don't want to mimic the language of our existing administration, but guess what? I have to agree that it's true. But it came from some of the people who were not ethical. They charge people for things that they didn't need. Um, they, there are stories of people getting homeless people and enrolling them into some of the Medicaid programs and charging for their services. So because there has been a lot of corruption, you have to do some reading. You can't just listen to me. You can't just listen to people. You as your home care CEO, home health care CEO, you have to do some of the research yourself and understand that some of the qualifications underneath the one big beautiful bill is they're going to have to verify some of the qualifications that make them eligible. Now, what no one has ever told you is that this eligibility requirement has always been there, but they would make it seem like, what what do we have to show eligibility? Why do we have things like EBV? That is where a home health care provider checks eligibility. That means that before this bill even happened, we were supposed to check eligibility. Why? Because someone's eligibility could have changed. But because they added a new factor in there and they put fear on top of it, and we don't understand things with, when we're afraid and we don't understand, that is a perfect combination of you being misguided and not able to make a lot of good decisions, right? Then you will then say, no, I'm not going to start this home care agency at this time. I'm not going to start this home care agency at this time. Oh, great. Wow. Dwayne Williams is in here. I would love, I would love for him to share how he helps people. Oh, that maybe that's not the right one. I know we have some scammers in here. Okay, thank you so much. Okay, I'm gonna be getting off because I just got a reminder that in 5 minutes, I have to jump on my Zoom with my mentee. Okay, okay, okay. On Facebook, I'm getting a message over here. Me, I had two clients, 24, 24 hours, 7 day a week. Annual revenue was 180,000. I can see 5 million being licensed with marketing. I want you guys to see this. You guys see this? This is Michelle. Yes, I do help with getting started. I can honestly tell you that today's live is not about me trying to sell you something. I can honestly tell you that today's live is not about me trying to get you into my program. Today's live is to get you to start doubting your doubts. I want you to ask yourself, if you're not licensed, what has been holding you back? Has it been your kids? Has it been that you're in a relationship? Has it been that you are, your work, you know, maybe you have a high demanding job. Maybe it's you trying to pay off debt. Maybe it's your finances. What is the reason why you have yet to start? Now, if you are licensed and you're stuck, you're not growing, I want you to also ask yourself, what is the reason why I haven't grown? Has it been your consistency? Has it been you going out and maybe you don't have a good sales presentation. Maybe you don't have a good marketing presentation. I was talking to a lady yesterday, and I she essentially was listening to too many people, and so she said she was going after um individuals. She wanted to market her postpartum care services because she said she heard me talk about it. Now the thing is, she heard me talk about it, but she didn't take my training. All right. So this is the thing when you guys get, I don't feel like I give surface information even when I do a live, but I can't cover everything during the live because we have questions, we have things that come up, and then the live has to end, just like it's going to be ending really soon, right? So, in closing, I said my nose is still itching. She said she's going to do postpartum care. I said, okay, send me a DM. I said she told me that she went to the hospital to market her home care business, um, postpartum care services. And I said, okay, why did you go to the hospital? So I like to ask questions so that you can think, not me just give you the answer. So she said, oh, because that's where the mom goes to have the baby. I said, okay. So you went there because that's where the mom wants to go have a baby. Okay. And so, yeah, so then I figured the hospital would just refer the mom to my postpartum care service. Right. So I said, okay. So in short, I said, when does postpartum care begin? Very simple question, trying to get her to think. I said, now, before she, where did she go before she had to go to the hospital for the baby? Oh, she went to her OBGYN. Okay. So you're telling me that the hospital, who don't have a relationship with that lady, where she went to go deliver the baby, is now going to refer the mom to your services. She had to think about that. I said, why would the hospital refer? Because she was literally thinking postpartum care begins in the hospital. Now, for some people, that could be very well true. But what the hospital got to do with the relationship of that person? Nothing. Hospital not doing no follow up. Anybody that had a baby, do you know where you get asked questions about the mental health of the mom? Anybody want to say quickly? Anybody know? Put it in the comments. I do have to go. Trying to catch up on bills. You will catch up on bills, Kathy. OBGYN, that's one. That's one. That's a good one. Anybody else want to? Do you have any other example? I love it. I love it. Nausea during your 6-week appointment. During your 6 weeks appointment. They ask you, how are you doing? They give you a little survey. They don't do it in the hospital. I'm sorry, I do have to go because it's 3 minutes past my meeting and they're already in the meeting room. I will try to get back on later, but if you learn anything today, I want you to know that um, you could be sabotaging your success. If you got bills to catch up on, please catch up on your bills. But guess what? Bills never go away. They never go away. And I'm definitely not encouraging you to be irresponsible, but bills never go away.